the pathway that allopathic medicine is taking in the United States with big pharma and commercials every 5 minutes on new medications. Could you comment on, is bioregulatory medicine in any way being introduced into current medical schools? Are we going to be making any headway in the next 10 years to change this trend of, the allopathic trend that you've been talking about? And how does it differ in America versus, what the trends are in Europe? I mean, do you have commercials on, every 10 minutes on big pharma and, the new medications and treating disease versus prevention?
Okay, I'm going to talk first and then maybe Dick is going to add a few things. So in Europe the situation is way more accepted. So it's part of the educational system of all medical or dental schools, maybe not to this extreme, and it's not mandatory, but you can choose courses you want to have. And of course the population, or the population's demand is much different, because we in Switzerland voted in 2007 on a people's vote to have naturopathic methodologies or biological medicine in parts in our insurance system, and we succeeded with 60% of the population wanting this. The government said, well, listen, we're going to do this for the next 10 years, but then we have to evaluate about the efficacy and the money we're spending on that, and we need to redo the people's vote. We redid it in 2014, and again, we remained with this system because we find it very beneficial. And to my practice, or to practices of general practitioners I'm befriended with, people not necessarily come to have the flu shots done. They want to have alternative methods how to prevent and how to increase their preventive behavior or their condition they're in at the moment. So the openness within the society, the openness within the medical schools or dental schools or universities, it's much different. And we have even, research funds going deeper into it. We're talking about hypothermia or whole body hypothermia treatments. The University of Heidelberg in Germany, for example, uses that already in cancer patients or in cancer conditions as a very useful tool, and they do it even with chemotherapy, without chemotherapy together. So it's much more open field where we can feel very comfortable that we are really taken care of, in the sense of we listen to the patient and we listen to the history, we take time, we take discussions, and it's even with general practitioners outside our boxes that we share a dialogue and that we share our experiences together, even in little rounds in our areas where we practice. So there is an openness, an unbelievable big openness. But on the other hand, of course, there are these strict allopathic doctors that don't want to mix. But this is maybe 40 or 20% of those. And so that is very, very different, because if I talk to colleagues here in the United States, even if I want to send patients over for after treatment, it's difficult to find them. But now we have the Biomed Center here in New England in Providence, so that's easier for me to really send patients back and have a follow-up, complete care.
Unfortunately, we're not in Europe, and the United States situation and Canada.
Not yet.
Right. The situation isn't quite as hopeful in one way. Unfortunately, it behooves the individual themselves to seek out this type of health care. So one of the things, it's always about insurance, and I talked to Frank about this earlier. As I said, is there a culture within kids growing up, within people? Because in this country, we've come to expect that health insurance is supposed to pay for everything. And then I'll say, well, do you have car insurance? Yeah. Well, does it put gas in your car? Does it pay for your new tires? But when do you use it? You use it in catastrophic accidents. What about your house insurance? Have you ever used it? Had a house for 30 years. Have you ever used it? No, never used it. What would you pay for it for? Why do you have health insurance? Just in case my house burns down. Well, if we think of health insurance as catastrophic support, that's really what we need it for. You have a car accident, you know, you have the unfortunate aspect of having a heart attack or cancer or something. We're talking astronomical. It's a good idea to have health insurance because in this country, bankruptcy is, the #1 cause of bankruptcy is an unfortunate aspect of a health crisis, we'll say. So, however, you should not expect your health care to pay for a routine lab test or to go and see a doctor to find out some of these functional type tests, in my opinion. So, and people don't have any problems paying $100, $150 for a cell phone, another $150 for their cable television, but ask them to put aside $250 for their own health care for the year, and they say, oh, no, that's supposed to be covered by health insurance. There's a mentality thing that needs to be, we need to be thinking about shifting. And unfortunately, is it happening in schools? My school, the one I'm about to teach. I'm going to try and teach physicians this whole idea. You know, Dr. Froderman there is one of my students, and as was Dr. Drobot years ago. So we have the ability to teach what needs to be. We need people, physicians out there who are truly looking for another way of supporting people other than the fact that it has to be through health insurance. We need a cultural change in the general public. That's what's going to change the medical system. But as long as people get freaked out that measles is there and EEG is there and you got to get a shingles vaccine, you know, in Arizona now, a kid by 5 years old needs 53 immunizations. By 5. And you can just imagine what that does to their immune system, to their neurological system, and every other system that hasn't even matured yet. This is an unfortunate issue that's happening within medicine, is we're getting so indoctrinated into that we think the doctor has to take care of us. It's not the doctor. The doctor just leads the pathway. I always say, you know, don't follow what I'm saying necessarily because, you know, I may not be leading you in the right direction. I'm not going to follow you. Maybe I won't follow you. So let's walk side by side, hand in hand. Let's make this a team. This is a teamwork. This is not, I'll tell you what to do. But it really comes down to what you do individually. And that's the best health insurance you'll ever get, is what you do for yourself.